Hi students, I welcome you all to Obstetrics and Gynecology with Mackler. In this module, we are going to discuss about the most important gynecological procedure which is performed in every single gynae OPDs till date, right? So it is the most important gynecological procedure which has been performed. So I have included everything which you need to learn about this pap smear in this module. So please give your attention and please take your notes, right? Okay. So what do you mean by pap smear? So pap smear means the whole word stands as Papa Nicolau smear. So who is this Papa Nicolau? This Papa Nicolau is the pioneer of cytopathology. He is a pioneer in cytopathology. What do you mean by cytopathology? It is the study of the cells. So they are cytopathologists, right? So this person, he is the one who originally invented this pap smear. So basically this pap smear is a cytological test. Pap smear is a cytological test. Now what do you mean by cytological test? It is the study of cells. Study of cells, and these cells are actually taken from the surface of the cervix. So pap smear is actually about cytological study, which is the study of the cells which are taken from the surface of the cervix. So this is all about the pap smear, right? And this is the most commonly performed gynecological procedures in OPDs. And the most important point is that it is a screening test. It is not a diagnostic test, but it is a screening test. So what is the difference between the screening and the diagnostic test? Screening test is one upon which we won't rely entirely on that particular test in treatment decision, right? But diagnostic test is one such test upon which we are going to further proceed on with the treatment. But with the screening test alone, with the test reports of the screening test alone, we can't proceed with any treatment. But on the other hand, in a diagnostic test, if the result comes to be positive, we can further proceed with the treatment. So treatment decision is not taken with the help of screening test alone. If the screening test comes to be positive, then we have to perform the definitive diagnostic test. So it is a screening test. So depending on the result of the screening test, further investigation has to be done, and the treatment can't be done with the screening test. Is that clear? So as of now, we have discussed about pap smear is Papa Nicolau smear. It is basically the cytological study of the cells which are taken from the surface of the cervix, right? It's the most commonly performed gynecological procedure in the OPDs, and it is a screening test. Okay, so now we need to learn some important points regarding this pap smear. The American College of Obstetrician and Gynecologists, they tell that it is the most common screening test which has to be performed for cancer cervix, and the screening has to start from in a female age about 21 years. So right from 21 years in every female, this screening has to be done. Starting from 21 years until 30 years, this test has to be done with a frequency of every 3 years. Right? So if a female is going to come to me at 21 years, I have to screen her for the cancer cervix. At 21 years, I have to screen her by taking the pap smear, and I have to ask her to come after 3 years for repeating this pap smear. So every 3 years, you're going to repeat the pap smear until the female turns around 30 years. So after 30 years, what are you going to do? So after 30 years, you have to perform this pap smear along with another important test. And what is that test? It is the most sensitive test. It is the HPV DNA test. In the previous module, we discussed that HPV DNA is a double-stranded DNA virus which is responsible for causation of the cancer cervix, right? HPV has many subtypes, 6, 11, 16, 18, of which the most commonly caused type of cancer is cancer cervix. So because of that reason, we need to perform HPV DNA test along with pap smear in patients who are more than 30 years. Is that clear? So basically pap smear is a screening test. ACOG recommends that screening for cancer cervix should begin from 21 years in a female, and it has to be repeated every 3 years until the female reaches 30 years. After 30 years, you have to couple this pap smear along with the most sensitive test, which is the HPV, human papilloma virus DNA test. Is that clear? Yes. So after 30 years, you have to perform this HPV DNA and the pap smear together. Until how many years you have to continue the screening? Are you going to do the screening routinely every year until the female is going to reach 70, 75 years? No. You have to perform this test only until 65 years, right? Because cancer cervix has, earlier it has a bimodal distribution, but now it is said to be around and on an average of 50 years. Okay, females who are around 50 years, it is said to be occurring more commonly. So until 65 years, you have to take the screening. After 65 years, you can get an exit from this pap smear test, right? Okay. And this coupling of pap smear and HPV DNA has to be repeated every 5 years. So after 30 years, you start the testing of pap smear and HPV DNA test. And this test has to be repeated only once in 5 years. So after 5 years, you're going to repeat it until the female reaches about 65 years. Is that clear? Shall I repeat it again? Okay. So, American College of Obstetricians and Gynecologists recommend that the screening test for the cancer cervix should begin in a female from 21 years. It has to be repeated every 3 years until the female reaches about 30 years. After 30 years, you have to couple this pap smear along with the most sensitive test, that is the HPV DNA test. So, this pap smear as well as the HPV DNA test has to be repeated every 5 years until the female reaches 65 years. After 65 years, you can take an exit from the screening test. Is that clear? Yes. So I told you that the most sensitive test is going to be HPV DNA test. But which is the most specific test? The most specific test is pap smear. So pap smear is the most specific test and HPV DNA is the most sensitive test, right? Sensitive test is HPV DNA, specific test is pap smear, right? Okay. So now we learned what is pap smear. It is basically the cytological test where we study about the cells which are taken from the surface of the cervix, right? Okay. So now what is the actual procedure of this test? So moving on to the procedures of the test, we actually have two methods, right? One method is called as the conventional method and the other is called as the liquid based cytology. Is that clear? One is done as a conventional method and the other is liquid based cytology. So while discussing about the conventional method, how many samples are we going to take? We are going to take 2 samples, right? We are going to take 2 samples, whereas in liquid based cytology, only 1 sample is taken. Okay. So the first sample of the conventional method is taken from where? We all know that in the previous module we have discussed that because of the squamous metaplasia which is occurring physiologically in every single female, if it is going to occur at a hastened or a faster manner, it is going to result in cancer cervix, right? So in that manner, the original squamocolumnar junction is going to recede back and become a new squamocolumnar junction because of squamous metaplasia. So because of this squamous metaplasia, the original squamocolumnar junction is going to get altered and it is going to move up inside and it becomes the new squamocolumnar junction. So the actual part between the original squamocolumnar junction and the new squamocolumnar junction, this entire zone is called as the transformation zone. And cancer cervix occurs most commonly in this transformation zone. Therefore, when we are screening for the cancer cervix, the first sample has to be taken from the transformation zone. Is that clear? Yes. The first sample has to be taken from the transformation zone. With the help of what? I'm going to use a particular specimen which is called as Ayer spatula. Can you see this? This is called as the Ayer spatula. With the spatula, I'm going to take the specimen or the sample from the transformation zone. Is that clear? So with this Ayer spatula, I'm going to take the cells from the transformation zone, right? Okay. Now the second sample is taken from where? we all know that endocervix is the part of the cervix which is not visible externally. So because of that reason, we also need to take sample from the endocervix, right? Why you need to take sample from the endocervix? Because cancer can also occur in the endocervix. The most commonly cancer occurs in the transformation zone, and the most common type of cancer is squamous cell carcinoma, right? But cancer can also occur in the endocervix. If it occurs in the endocervix, it is called as adenocarcinoma, because we all know that endocervix, the lining epithelium is the columnar epithelium. So since the lining epithelium is columnar epithelium, the most common type of cancer to arise from the endocervix is adenocarcinoma. So because of that reason, sample needs to be taken from the endocervix also. So first sample you are taking from the transformation zone, which is the most common zone for the malignancy to occur, right? And the most common type of cancer to occur in the transformation zone is the squamous cell carcinoma. Okay, and the second most common type of cancer to occur in the cervix is the adenocarcinoma, which occurs in the endocervix. Therefore, the second sample has to be taken from the endocervix. But with this spatula, with this IR spatula, which is actually a wooden spatula, right? With this IR spatula, you can't take the sample from the endocervix, because we all know that the endocervix is not visible externally. So because of that reason, you have to take a special instrument, and that is called as the name suggests, it is called as endocervical brush, right? Let me show you here. This is called as the endocervical brush. It has several bristles. So you are going to introduce inside this, and you are going to gently rotate in 360-degree direction, and you are going to take the sample from the endocervix. That is, the surface cells which are present in the endocervix are going to be taken with the help of this endocervical brush. Is that clear? Yes. So let me have a small gist here. The most common cancer cervix is squamous cell carcinoma, and it occurs most commonly in the transformation zone. Transformation zone is the zone between the original squamocolumnar junction and the new squamocolumnar junction, which happens because of the squamous metaplasia, right? And the second most common cancer to occur in the cervix is the adenocarcinoma. Why it is adenocarcinoma? Because the second most common type of cancer occurs in the endocervix. Endocervix is lined by the columnar epithelium. So since it is columnar epithelium, the second most common type of cancer to arise in the cervix is adenocarcinoma. Therefore, because of that reason, we need to take the sample both from the transformation zone as well as the endocervix. So in order to take the sample from the transformation zone, in conventional method, we are taking the samples from the transformation zone with the help of the IR spatula, which is basically a wooden spatula, right? Okay, now the second sample has to be taken from the endocervix, and with the help of the endocervical brush, which has several bristles in it, the surface cells are taken from the endocervix, right? So okay, so what you are going to do is that you have to spread it in a slide, right? The name itself suggests that it is pap smear. So what do you mean by smear? You have to smear the sample in the glass slide. Only then you can examine it under the microscope. So what you are going to do is that once you take the samples from the transformation zone, you have to place it in the glass slide. After that, you are going to take the sample from the endocervix with the help of endocervical brush. You have to place the same sample in the same glass slide. So the single glass slide contains both the sample from the transformation zone as well as from the endocervix, right? So once you have smeared the glass slide, now you have to put it in a fixator. Only if you put in a fixator, after that you can visualize it under the microscope, right? The fixator which is used in the conventional method is 95% ethyl alcohol, 95% ethyl alcohol and ether, right? So the fixator used in conventional method is 95% of ethyl alcohol plus or minus 5% ether, right? 5% ether, 95% ethyl alcohol. So ethyl alcohol and ether 95 5 percentage is used as a fixative in the conventional method. In conventional method, you are taking two samples. The first sample is taken from the transformation zone with the help of IR spatula. Place it in a slide. Second sample from the endocervix with the help of endocervical brush. Place it in the same slide. Put it in the fixative and then examine. Now moving back to the liquid-based cytology, here samples are taken from a single zone. Is that right? No. What here is that ideally you have to take the sample from both the transformation zone and the endocervix. But unlike the conventional method, you are not going to use any two different spatula. Like in conventional method, you used IR spatula as well as endocervical brush. But in liquid-based cytology, you are going to use only one instrument, right? With the help of only one spatula or a brush, you are going to take sample from both the endocervix as well as the transformation zone, because we all know that cancer cervix can occur in the transformation zone as well as in the endocervix. Therefore, in screening test, you have to take the sample from both the transformation zone as well as from the endocervix. But the difference is that in conventional method, we use two different brush or spatula, whereas in the liquid-based cytology, we are going to use only one brush. With the help of one brush, we are going to take the sample from both the transformation zone as well as from the endocervix. So, therefore, the sample is taken from both the transformation zone. Actually, it is the two sample, but with the help of single brush. Right? So the sample is ideally taken from the transformation zone, and it is also taken from the endocervix. So sample is taken from the transformation zone and the endocervix with the help of only one brush, and that brush is called as cervical brush. Only one brush, and that brush is a cervical brush. Let me show you that. So as you can see here, right? So this is the cervical brush. So with the help of this cervical brush, you are going to take the sample from both the transformation zone as well as the endocervix. Therefore, in conventional method, you are going to take two samples with the help of two spatulas. Right? Two samples from two spatulas. But in liquid-based cytology, you are going to take two samples but with the help of a single spatula, right? So with the help of a single cervical brush, you are going to take the sample from the transformation zone as well as the endocervix. Now, what is the fixative? It is very easy. The fixative is methanol, right? So shall we do a small revision here? Yes. Okay. So in conventional method, two samples are taken. In liquid-based cytology also, two samples are taken. What are the two samples? One is from the transformation zone and the other is from the endocervix, because cancer can occur more commonly in the transformation zone followed by the endocervix, right? Okay. Here, in conventional method, the first sample is taken from the transformation zone with the help of IR spatula. The second sample is taken from the endocervix with the help of endocervical brush. Both the samples are placed in a glass slide and smeared, and it is put in a fixative. The fixative is 95% ethyl alcohol plus minus 5% ether. In liquid-based cytology, sample is taken from both the transformation zone and the endocervix, but with the help of a single cervical brush. After taking the sample, you have to put the entire brush, after cutting the entire length, okay, you have to place the brush inside the fixative, and that fixative is going to be methanol. As you can see in this image, what is he doing? This is the fixative which contains the methanol, and this person is actually going to cut here, and he's going to place this entire thing inside this bottle and close it, right? So the fixative for liquid-based cytology is methanol. Is that clear? Yes. So until now we discussed what is pap smear, and basically pap smear is a cytological study where the cells are taken from the surface of the cervix, and we had two methods. One is conventional method and the other is liquid-based cytology. Okay, so now you tell me when to do this pap smear. Can you do in any day of the menstrual cycle in a female? No, you can't do in any day. You have to do in around 8 to 12 days of the cycle, which is roughly the pre-ovulatory or peri-ovulatory period, right? So we all know that ovulation occurs at around day 14 of the menstrual cycle. Menstrual cycle is around 28 days, or at day 14 ovulation will occur. So before the ovulation occurs, around day 8 to 12, you can perform this pap smear test. This is because that if a female is going to menstruate, the menstrual blood is going to be a hinder for me to perform this test. So when a female is menstruating, you can't perform this test. As well as when a female is going to get pregnant after the ovulation, we won't be aware enough that whether the female had been pregnant or not, right? So because of that reason, we are not going to perform this test anywhere later after 14 days of the menstrual cycle. But you also need to remember that pap smear is relatively a safe test which can be done in pregnancy. Safe test to be done in a pregnant female. But then the most commonly recommended period is the peri-ovulatory phase, that is around day 8 to 12 of the menstrual cycle. Is that clear? Yes. Okay. So now there has to be certain prerequisites and contraindications. So what are the prerequisites? The prerequisite is that the female has to have some sexual abstinence. She has to have some sexual abstinence, right? Sexual abstinence has to be there. Apart from that, she should not be menstruating, no menstruation. And then if she is going to have some tampons inside her vagina, right? No tampons inside the vagina, and recent douching should not be done, because if she is going to douch, it is going to alter the pH of the inside epithelium, right? So if the pH is going to alter, therefore certain cells can be missed off, right? So recent douching means cleaning, right? So recent douching, insertion of any tampons, if the female is going to menstruate, she should not be menstruating during that period, and sexual abstinence is very important. Apart from that, the contraindications are, there is no absolute contraindications to pap smear, but certain relative contraindications are there. Those are any active bleeding, it should never be done, and any active vaginal or cervical discharge, which signifies vaginal or cervical infections. So these are the prerequisites and these are the contraindications for pap smear. Is that clear? Yes. Okay. So now, when you take a report of pap smear, it will contain certain details like this. It will contain the name of the patient, the age of the patient, the smear. In smear, it will be mentioned whether it is satisfactory, right? Whether it is satisfactory smear or whether it is unsatisfactory smear. What is satisfactory and unsatisfactory? Satisfactory means whether the smear contains adequate amount of cells which it has to contain, or whether the sample which has been taken is inadequate. So based on that, the pathologist will give this term satisfactory smear or unsatisfactory smear. So the Bethesda gives a report that what is a satisfactory smear and what is an unsatisfactory smear. So Bethesda tells us that satisfactory pap smear is one which contains these number of cells but high power fields. So it gives the rough estimate for both the conventional as well as the liquid based cytology. For conventional method of pap smear, Bethesda tells us that a satisfactory conventional pap smear should contain about anywhere around 8,000 to 12,000 squamous cells per 10 high power fields. Whereas Bethesda tells for the liquid based cytology that a satisfactory liquid based cytology should contain around 5,000 squamous cells per 10 high power fields. Bethesda is basically the reporting system for the cervical cytology, right? So Bethesda is the reporting system. So this Bethesda tells us that a satisfactory conventional pap smear should contain about 8,000 to 12,000 squamous cells per 10 high power field. Whereas the liquid based cytology has to contain about 5,000 squamous cells per 10 high power field. right? So let me write here this also. It is basically reporting system for cervical cytology. Bethesda, there is a reporting system for the cervical cytology, and Bethesda also tells for thyroid cytology, which we will discuss in surgery, right? So Bethesda is a reporting system for cervical cytology. It tells that the conventional pap smear should contain about 8,000 to 12,000 squamous cells per 10 high power fields, and the liquid based cytology has to contain about 5,000 squamous cells per 10 high power fields. Now, did Bethesda told about the endocervical cells? It told about the squamous cells for us. What about the endocervical cells? Yes, Bethesda told about the endocervical cells also, but it is the same for both the conventional and the liquid based cytology. It tells that around 10 to 12 endocervical cells is enough. 10 to 12 endocervical cells is enough to tell it is a satisfactory smear. So a satisfactory smear is that a conventional means it has to be 8,000 to 12,000 squamous cells per 10 high power fields and 10 to 12 endocervical cells. For liquid based cytology, 5,000 squamous cells per 10 high power fields and 10 to 12 endocervical cells. So only then Bethesda tells us that this is a satisfactory pap smear. So as I told you earlier, the report of pap smear will contain the name, age and the smear, whether it is satisfactory or unsatisfactory. It will give us a description about the cytopathology study which has been done by the pathologist, and finally the impression will be given. So this is the impression of the pap smear. You have to remember these 5 things. When we discuss in the later session about the other available gynecological procedures for the cancer cervix, finally then we will be able to know what is the ideal next step which has to be done following this report. But as of now, you need to understand what are these impressions. So basically, a pap smear can give us about 5 results. And since it is a screening test, no treatment will be done based on the report of the pap smear. Based on the pap smear, another diagnostic test has to be done. Is that clear? Okay. So the impression can be like atypical squamous cells of unknown significance. What do you mean by atypical squamous cells of unknown significance? They are telling that these squamous cells are not normal. These squamous cells are atypical, right? And we don't know the significance of this atypical squamous cells. So it is atypical squamous cells of unknown significance. Or it can be low-grade squamous intraepithelial lesion. There is an intraepithelial lesion in the cervix, but it is a low-grade lesion. Or it can be a high-grade squamous intraepithelial lesion. Or it can be atypical squamous cells where high-grade squamous intraepithelial lesion can't be ruled out. So 4 impression is all about the squamous cells, and the 1 impression is all about the adenocarcinoma. Is that clear? Adenocarcinoma. So it is the description about the columnar cells. So 4 impression will direct us towards the squamous cells, and 1 impression is all about the columnar type of epithelium which is present in the endocervix, where adenocarcinoma tends to occur more commonly. So what are the 4 things of squamous cells? Atypical squamous cells of unknown significance, low-grade squamous intraepithelial lesion, high-grade squamous intraepithelial lesion, and then atypical squamous cells where high-grade squamous intraepithelial lesion can't be ruled out. So it is called as ASCH. So all these are 4 or about the squamous cells. The one about the columnar cells is atypical glandular cells of unknown significance. What is glandular? Glandular means columnar. Glandular means columnar. So atypical glandular cells of unknown significance. So these will be the impression of a pap smear. So once you get the impressions of the pap smear, the next step which has to be done will depend upon the age of the patient. If the patient is going to be under 25 years, let's say for example, or if the patient is going to be an elderly female, what is the next diagnostic test which has to be done? We all know that pap smear is a screening test. So based on the screening test, no treatment will be done, right? So the next step of the pap smear will be a definitive diagnostic test, and this diagnostic test differs based on the age of the female. So in the subsequent modules, we'll be discussing about the further gynecological procedures which are performed for the detection of cancer cervix. So when we discuss about that, we will discuss about the further steps which has to be taken following the impression of the pap smear. So I hope until now it is very clear for you what is pap smear and what are the different procedures, conventional method, liquid based cytology, and which is the most sensitive test, which is the most specific test, and everything, right? So I hope everything is clear for you. I have to tell you only one thing, right? What is the speculum? So this speculum is Cusco's bivalved vaginal speculum. And the advantage it is that it is a self-retaining speculum. You need not hold the speculum. Once it is held in place, it is going to retain itself, and it is mainly used to hold in place the anterior and the posterior vaginal wall. So this will hold upon the anterior and the posterior vaginal wall as it is shown in this image, right? So this is the Cusco's bivalved self-retaining vaginal speculum. As you can see here, it holds the anterior and the posterior wall of the vagina, and the physician is actually taking the samples from the cervix. As you can see here, it is the cervical brush which has been used to take the samples from both the transformation as well as the endocervix. So this is the method of liquid based cytology which is shown in this image. Because as you can see the size of the brush here, right? So this is the cervical brush which is used in liquid based cytology. So this is the procedure how which the specimen is taken from the cervix. Is that clear? Right? As you can see here, this is the normal cervix. The visible portion is the exo or the ectocervix. This is your external os. Whereas the cancer cervix is shown here, right? So once you are going to take the sample from the cervix, once you examine it under the microscope, you are going to get an impression. Based on that impression, you are going to go with some definitive test. Is that clear? And then depending upon the result of those diagnostic tests, the treatment will be decided further on. Is that clear? I hope everything is clear until now for you students. If you have any doubt, please write to us in the Mackler handle. We will reach out to you as early as possible. Thank you.